Hello, my name is Alex Sabosi, and this is my video on tuberculosis. To discuss tuberculosis, we must first know what it is. Tuberculosis is an intracellular pathogen that is a gram-positive bacillus. It affects the macrophage within the human body and is an obligate aerobe, making it slow growing and also slow progressing. The outside of the cell wall is unusually waxy, which makes it highly resistant to drying as well as to antibiotics. The primary infection occurs in the lungs, but can spread to other parts of the body. 2 billion people are infected worldwide, but these cases are usually latent, with only 5 to 10% of infected people developing the disease. I imagine personally that it would be harder to treat TB infections when the bacterium is latent because you first must be able to diagnose it. With latency, it is asymptomatic, therefore the patient may not even know that they have tuberculosis. When latent, the disease is controlled by the host's immune response, and at this time they cannot spread the bacteria. Of course, the concern is that reactivation will occur. There are tests such as the skin test that can be done to diagnose the latent form of tuberculosis, and this may be done in areas with a high rate of the disease. At this point, normal therapy can be done for TB if the physician believes it is necessary. However, this does not guarantee the eradication of the disease within the body. The best measure of action for treatment would be educating the latent patient on signs and symptoms of reactivation to ensure that if it does occur, they are seen promptly by a physician. As for the ethics question, I believe that there is some legal recourse that can be taken with a patient such as this. If the patient is infected with the extremely drug-resistant form of tuberculosis and refuses to follow a doctor's orders, he is then knowingly putting the general public at risk. If he continues to go out to dinner, travel on airplanes, and in general have contact with the population around him, he is putting people, especially immunocompromised people, such as the elderly and young, at risk of the disease. Ethically, someone may choose the route of counseling the patient to help him better understand that he is putting others in danger. But if this has already been done and the patient continues to go out and not follow his doctor's orders, I do believe that jailing the person, in a sense, would be an appropriate measure. Personally, I feel that a medically supervised hold within a quarantine section of the hospital would be most appropriate. If this is not achievable or seen as too extreme, I believe that house arrest for the patient may also be an option. After doing some research on the CDC's website, I found that such measures are covered under the Public Health Service Act, Section 361, which allows the authorities to take measures preventing the spread of disease from between states, making this patient in violation with his plane travel and subject to being detained. Ethically, the autonomy of the patient is important, but the health of the general population outweighs the autonomy of one man putting the population in danger knowingly. Thank you for watching my video, and I hope this sheds some light on tuberculosis, latent tuberculosis, and the ethics behind someone with an extremely antibiotic resistant form of tuberculosis. Thank you.